Hello, everyone, and thank you for joining us for this evening for week 7 of the Rugby Research and Injury Prevention Group 2025 Journal Club. My name is William McIntyre. I'm a rising senior at Howard University studying sports medicine. We will begin our first Journal Club presentation with our first intern, Lawrence Cangro. He is a sophomore at Alabama College of Osteopathic Medicine. Lawrence will be presenting on optimizing sprint performance in rugby. Lawrence, may you please share your screen?
Yes, thank you. Can everyone see my screen? Perfect. So my name is Larry Kenger. I'm going into my second year at the Alabama College of Osteopathic Medicine. And today I'll be talking about optimizing sprint performance in rugby. This is a systematic review from the Journal of Functional Morphology and Kinesiology. So getting right into it, why does sprinting matter in rugby? So it's critical for offense and defensive success. Sprinting involves acceleration, agility, and repeated sprint ability. So this is just how many times you can kind of start and stop, and how many, I guess, sprinting activities you can do in a row without break. Um, the sprint demands vary by position, backs versus forwards, and so on. Everybody has a different amount of sprinting they have to do. And then obviously faster players and people who can sprint more on demand create more scoring and tackling opportunities. So the overall objectives of this review, identify some training methods that will improve sprint performances. It's going to focus on semi-professionals and professional rugby players, and it's going to provide some evidence-based recommendations for coaches to train players in sprinting. So looking at the methods, it's a systematic review. We have a big list of search terms we use that they use to find the articles for the systematic review. So the inclusion criteria included players from the rugby union, rugby sevens players, and players who use resistance or specific training for over or equal to 4 weeks. They have to be 16 years and older. And again, it's professional and semi-professional rugby players only. And looking for articles where the measure of the outcome was sprint performance over 5 to 40 meters. Those who were excluded, amateurs, recreational athletes, or those under 16. Um, any that used interventions with advanced technology, and then systematic reviews or any unrelated sports samples. A Pedro scale was used for randomization, and then the data extracted from these articles would be participants, the training type, frequency, the duration, sprint distances, outcome measures, and then pre and post data. So this is just looking at how the articles were selected, how the researchers combed through each articles and determined whether they fit or not. So it's just basically a flow chart to see how you could follow their methods of selection. So looking at an overview of the results, 13 out of 26 of the studies selected showed significant sprinting improvements. Um, Most improvement was seen in the 5 to 20 meter sprints, and we see a notable reduction in sprint times, specifically for this one by Comfort et al., with the 10 meters going down from 1.78 seconds to 1.65 seconds after training. And we see some different training types, which we're going to go into next. So looking at the resistance training findings, it's most effective when you combine it with plyometrics, agility drills, any power-focused work. You want to have planned progression and tapering, and this is going to enhance the results of that resistance training. Eccentric and unilateral training can also help, and then feedback from coaches is going to boost performances in this specific training. Some limitations, vertical only strength training is ineffective. It's if you have a poorly individualized program, you're going to lead to insignificant gains. And then overtraining or no sprints specific work could lead to failure. Looking at small-sided games, which is just either doing 3v3s or 5v5s in terms of the training. So, like I said, it's going to simulate real games, and this is going to improve agility and short distance sprinting, so that 10 to 40 meter kind of area. And doing this method is going to increase the training engagement and intensity with the players. Some limitations is it's less controlled intensity compared to some of the other structured sprinting drills. There may be some plateau with improvement. And then it may not target that maximum sprint velocity like you can with some more focused drills. And then looking at resisted or assisted sprinting. So this is going to be like your sled sprints, and these are going to boost your acceleration. So it's not as effective for reaching a max speed, just more going from 0 to whatever your max speed is, acceleration, like it says. Um, and again, boost, it's best for static starts and change of direction, but some limitations could be if there's some improper loading, if it's too heavy or too light, this could reduce effectiveness. It could alter sprint mechanics if you overuse it, and there's a limited impact on sprint endurance or top speed. So some recommendations, you want to combine resistance, plyometric, and sprint specific work. You can use the small-sided games weekly, use sled sprints for acceleration, and you want to periodically do the training and taper properly for that first method we talked about. So in conclusion, sprint performances is trainable in rugby, and you have to use the right methods. The best results come from tailored, periodical, and multi-component training. And coaches should align training with competition schedules for maximum effect. Thank you. And are there any questions?
Thank you, Larry, for that presentation. Are there any questions, or Dr. Lopez, do you have anything to add?
Larry, you did a great job. I think bringing up the sled speed, knowing that you're not trying to get to max, you're just trying to get closer to max faster. If that's the best way of phrasing it, I think everyone misinterprets the sled activities, and they overdo those. Meanwhile, they don't incorporate as much training. Overall sprinting itself, they tried to make that acceleration to max, and they're not emphasizing, trying to get the mechanics for the sprinting. And I think that's an important aspect. uh they didn't talk about lateral or juking, did they?
I don't believe they did. I don't remember seeing it.
Everyone, so what it is that because rugby is so dynamic, right? And we're not even going to go into sevens per se. Let's go to just 15s, right? You're running, stopping. You're also laterally running. I think there's a new, you could even see it more often where players are hopping laterally, step foot to foot to avoid tackles, right? Or to elude tackles to give yourself more time to pass the ball. You'll see that this is probably something because of the way rugby has evolved. Now, when we talk about sevens, that's a whole nother animal. The deceleration and the acceleration is at some serious speeds. And this is where they've actually commented on this. It's really, really dynamic. So the importance is, I think the overall training and speed part is really kind of significant. Um, okay. So I think for a fact that if the players are being trained on their sprinting, it's beneficial for them. I do think if they're training on their acceleration speed, it's also beneficial for them, but more needs to be done as well. And I think if any one of you have looked at a little bit of videography regarding rugby, it is quite dynamic. And let alone what we've been seeing more of the sevens play. So I do think this study contributes. definitely, but it definitely didn't incorporate the change in directions. It didn't discuss that. Am I correct, Larry?
Yeah, I think they grouped it in more with like kind of acceleration almost in that aspect, but I wouldn't say directly.
Yeah, it's a challenge. I mean, also you got to remember, men, because the sport is still being evaluated and looked at, the science of it. These papers are pioneer. They're really good papers discussing what's going on about the sport. Thank you, Larry. That was a good job. Good topic.
Thank you, Dr. Lopez. Our second intern is Violet Torres, and she is a rising junior at Ethica College. Violet will be presenting on counter movement jump standards in rugby league. Violet, may you please share your screen?
Yes, thank you, William. Can everyone see my screen? So as William said, I will be discussing the counter movement jump standards, excuse me, in rugby league. What is good performance? This article was pulled from the Journal of Strength and Conditioning Research, and it's from 2022. So just a little background. The counter movement jump, also known as CMJ, is widely used in rugby league to assess lower body power, reactive strength, and athletic performance potential. CMJ metrics like jump height, reactive strength index modified, mean and peak propulsion power are commonly tracked. There is no clear consensus that exists for a good performance specific to rugby positions, and in this case it'd be forwards and backs. And past studies lack standardized testing protocols, making cross-study comparisons quite difficult. Typically, forwards are heavier and more strength-based roles, where backs are lighter, faster, and agility-focused roles. The inconsistent use of jump mats versus force plates is what caused the difference in sampling rates. And CMJ is a standard tool that is used for neuromuscular assessment. So the primary goal was to establish reference values, essentially percentile rankings for CMJ performance, and these were broken down by position, allowing coaches to identify whether a player is performing below average, at standard, or elite for their specific role. And secondly, they wanted to test whether CMJ metrics significantly differed between forwards and backs and whether these differences justified separate standards. So the methods used were that there were 104 senior male rugby league players, there were 55 forwards and 49 backs. They were pulled from 12 teams from the English Super League as well as the Rugby League Championships, and these players ranged from 18 to 34 years old. The CMJ testing, the way that they went about it was 3 maximal effort jumps per athlete on a force platform with about a minute of rest per jump. They also had the athletes place their arms in a specific way to minimize the movement of their arms and to prevent any confusion or issues when they began to jump, and in order to keep the metrics as calculated as possible. So the key metrics that were calculated were jump height, which is just how high the athlete jumps, reactive strength index modified, which is just the measure of explosiveness calculated by dividing the jump height by the time that they took off, and mean and peak propulsion power, which is relative to the body mass, just indicates how much force the athlete generates during jump takeoff. And the data processing was force time data analyzed using validated criterion methods, which is just based off the metrics that I just mentioned. So the results that were included in the study, the backs significantly outperformed the forwards across all CMJ metrics. And the jump height, the backs had a 0.367 meters, where the forwards had 3.4 meters. The RSI mod was 0.48 for the backs and 0.45 for the forwards. The mean was 31.4 1.5 watts per kilogram for the backs and 29.1 watts per kilogram for the forwards, and the peak was 54.4 watts per kilogram, as well as 51.3 watts per kilogram for the forwards. So as you can see, these results support creating separate standards for forwards and backs because of the difference in results. And given that their positions are specifically different for body type, it just makes the most sense to make sure that that is differentiated and spoken about. The percentile reference scales, which were the 3rd and the 97th percentile, they were developed separately for backs and forwards, enabling practical use by coaches and trainers. And large effect sizes and statistical significance supported the differentiation between these playing positions. So as for the discussion, backs are superior with the CMJ performance because it's attributed to lower body mass and roles that emphasize speed and reactivity. Forwards, although stronger and heavier, they require greater force to achieve similar jump velocities due to the mass-induced mechanical disadvantages. CMJ metrics favor lighter athletes in metrics like velocity and power per kilogram, and using position-specific benchmarks helps to ensure fair and relevant evaluations, as well as performance improvements, which should be considered both relative power and momentum, which is important, especially in a contact sport like rugby. So this figure displays the distribution of counter movement jump performance for backs and forwards using percentile ranking. And as you can see, the squares represent the backs and the diamonds are representing the forwards. And you can see in each of these different metrics, the backs are just slightly, excuse me, the forwards are just slightly more advanced than, or just showing better with the correlation coefficient. You can also see that the coefficients in this figure show that the jump height and other metrics had strong positive associations with being a back. Some limitations to the study were that the results were based on only UK male senior athletes, which is not generalizable to youth, female, or non-professional athletes. All the data that was collected was only during the preseason, and values may differ in season due to fatigue, training load, or recovery. All CMJ metrics are biased and in favor of lighter athletes, and therefore heavier athletes may be underrepresented in performance rankings unless body mass and role are considered, like in this study it was. This is just important to make note of for future studies. And not all influencing factors like psychological state, soreness, or training history were accounted for in the CMJ outcomes, which I think it's important to make note of the fact that this was specifically during the preseason and the athletes are well rested this time. They haven't really gotten into their training, and it's important to make notes of these things, that the fatigue and training load or recovery was not a factor in this study. So just some key takeaways. The study fills a gap by providing a clear force platform-based CMG norms for rugby league athletes, and backs outperform forwards on CMJs due to the body composition and positional demands. CMJ metrics can reflect physical readiness and development. They can help with talent identification, and they guide with training priorities. And the practitioner should use the provided percentile tables, combine CMJ data with strength, speed, and injury data, as well as avoid over monitoring highly correlated metrics. And these are my references.
Thank you, Violet, for your presentation. Are there any questions? Or Dr. Lopez, do you have anything to add?
And another great study looking at conditioning and understanding athletes' readiness. I think Violet, you did a great job pointing out the limitations of when they did it. They did it when the athletes were in their best shape. I think to clarify, a CMJ testing may be best to evaluate. Maybe you can use it as a tool to evaluate readiness over the season too. So I think the best way of phrasing that, you can use it for tracking. So basically, you can envision that if you did this mid-season or towards the end of the season, these players probably wouldn't do so well with their nags and their injuries and their strains they've encountered over the season. So it's something you need to consider. But again, great job in presenting another conditioning training topic.
Thank you, Dr. Lopez. Our third and final intern will be Minna Ko, who is a rising senior at Lydian Academy. Minna will be presenting on revision, uptake, and coding issues related to the open access of Orchard Sports Injury Classification System, also known as O6. Minna, may you please share your screen?
Can you see my screen? Yes. Okay. Uh, Good evening, everyone. Today I'm going to be talking about the Orchard Sports Injury Classification System, otherwise known as O6. Specifically, I'm going to cover the revisions, how it's been widely adopted, and some of the coding challenges that have come up over time. So O6 is an important tool that helps to standardize how we classify sports injuries, which makes data collection and analysis much more effective. And its purpose is to review the revisions and assess and basically identify coding issues that have been associated with the system. O6 was first introduced in 1993 to give healthcare professionals a consistent way to document source injuries, and since then it's been revised several times to make it more accurate and better suited for use in different sports and medical settings. Its main strengths are the wide usage, and it's able to code specifically to sports medicine, and it's also free to use. So the study had three main goals. First was to review the updates that had been made to O6 over the years. Second, it was to see how widely it's been adopted in sports medicine communities. And third, it was to identify and explore common issues that people face when using the system to code injuries. The researchers conducted a thorough review of O6 updates and looked at how it was being used in different clinical and sports settings and analyzed the most frequent coding problems practitioners have reported. And the study found out that even though O6 had been widely adopted, there were still a few issues that stood out. Um, some injuries categories were still unclear or hard to interpret. Different users sometimes code the same injury in different ways, and the system needed regular updates to keep up with new injury types and new medical terms. So what does that mean for practice? Mainly that this means that O6 needs to keep evolving. Regular updates are key, but it's also important to make sure that practitioners are properly trained in how to use the system to keep coding consistent and reliable. The studies did suggest a few ways to improve things going forward. They said to develop standardized training programs for O6 users, set up a way for users to give feedback or report any coding issues, and make sure that the system was being updated regularly to reflect new knowledge in sports medicine. Overall, O6 is a pretty valuable resource for classifying sports injuries, but also like any other system, it does need regular attention. And addressing coding challenges and keeping the system current will help ensure that it stays useful for both clinicians and researchers. Um, this was my references, and thank you for listening.
Thank you, Minna, for your presentation. Are there any questions? Or Dr. Lopez, do you have anything to add?
Yeah, no,
Yeah,
thank you. Go ahead. Sorry, Asha, go ahead.
sorry, yeah. I just wanted to point out that because this is a 2010 study, the name O6 has now been changed to the Orchard Sports Injury and Illness Classification System. So there will be an extra I there, but the entire classification system, the way it works, essentially stays the same. It just helps people be able to categorize their injuries and essentially try to group that in order to make good predictions about injury, especially epidemiology. So I just want to say, clarify that point, and also great job, Mina.
Hi, Mina. I wanted to say it was a great presentation, and I really appreciated the way that you explained O6. It was a great presentation.
Yeah, thank you for the point, Asha, and thank you for the comment, Nadira. You know, the the O6 coding system has been evolving now and really sets the standard of how you should be coding sports injuries. Luckily, we were fortunate to have employed that early on from the beginning when we started. And I guess the unique thing is that we've been able to evolve with the different definitions as well as the consensus statements throughout. So this is just one more thing that we've been able to, stay up with and try to see if we can try to, evolve our data appropriately to be interstudy comparability capable, and then allows us to, look at our data comparatively to countries that are looking at it. So thank you. I think that was a great talk.
That will conclude week 7 of the Rugby Research and Injury Prevention Group Journal Club. Thank you all for attending.